Assalamu alaikum and welcome to Ehsan's Biology. Today, we are going to explore a life-saving medical procedure, the kidney transplant, also called a renal transplant. What is it? Who needs it? And how does it change lives? Let's find out. A kidney transplant is a surgery in which a healthy kidney is placed into the body of a person whose kidneys have stopped working properly. It's called renal transplant because renal means related to kidneys. A kidney transplant is needed when someone has end-stage kidney failure. This means their kidneys have lost about 85 to 90% of their function and cannot clean the blood or remove waste. In such cases, dialysis or a transplant becomes the only option to survive. The donor is the person who gives the healthy kidney. The recipient or host is the person who receives it. Both must go through careful testing before the surgery can happen. A kidney donor can be a living person, like a parent, sibling, friend, or even a kind stranger. Or a deceased person, someone who agreed to donate their organs after death. Donors must be healthy, have normal kidney function, and pass all medical tests. Before the transplant, doctors do several tests to make sure the kidney will match. These include blood tests, tissue typing, crossmatch test, medical and psychological evaluation. Only when everything matches, the surgery is planned. Even after a successful transplant, there can be problems. The body might reject the new kidney. The patient can get infections or side effects from the medicines. That's why patients must take immunosuppressive drugs for life to stop their body from attacking the new kidney. A donated kidney from a living donor can work for 15 to 20 years, sometimes more. From a deceased donor, it may last around 10 to 15 years. Healthy living and regular checkups can increase its life. Kidney transplant is truly a second chance at life. If you learned something new today, like, share, and subscribe to Ehsan's Biology. Comment below if you have questions or need this in Urdu too.